Welcome to The Explainer. Today, we are going to demystify the medical journey so many couples go on when they're looking for answers about their fertility. We're going to break down the standard evaluation process step by step, really digging into the established medical guidelines. Okay, let's just dive right in with this number. 10 to 15%. I mean, just let that sink in for a second. That's how many couples of reproductive age are dealing with infertility. So, if this is something on your mind, the biggest thing to take away from this is that you are not alone, far from it. So, what do we even mean when we say infertility? Well, the technical definition is, not being able to conceive after a whole year of trying. But here's something really important. For a lot of couples, a better, more accurate term is actually subfertility. And look, this isn't just about playing with words. It's a real shift in how you look at it. It basically suggests that, hey, conception is probably still going to happen. It just might take a bit more time. And honestly, that can be a really reassuring way to think about it. All right, so what causes infertility? This is where it gets really interesting. It's so easy to think of it as a female problem or a male problem, right? But the data just doesn't back that up. It's split almost perfectly into thirds. About a third of the time, it's a female factor. Another third, it's a male factor. And that last third is either a mix of both or it's just unexplained. And that right there is exactly why it is so important that both partners are in this together, right from the very first appointment. Okay, so here's our game plan for today. We're going to walk through this whole thing just like you would in real life. We'll start with that first big consultation, then dive into the evaluation for the female partner, then the male partner. And we'll wrap up by talking about genetics and how all of this information comes together to give you a clear path forward. All right, let's get into it. The very first step. The whole journey really just kicks off with a conversation. That first consultation is the foundation for everything. And it's absolutely key that both partners are there. So what actually happens in that first visit? Well, your doctor's going to do a real deep dive into your medical history, and I mean everything, from surgeries you've had to lifestyle stuff like your diet, smoking, alcohol. You'll also get into the practical side of things like, frequency and timing. And it's also a great chance to bust some common myths like whether a certain position matters, spoiler, it doesn't, and just get rid of some of that unnecessary stress. Okay, now let's focus on the evaluation for the female partner. Doctors have this really clear, logical, three-part investigation to figure out what's happening. And those three pillars are basically three big questions. First, is ovulation happening like it should, on a regular basis? Second, is the anatomy, we're talking the uterus and fallopian tubes, is everything clear and working correctly? And third, what's the deal with the ovarian reserve, which is really just a way of asking about the quantity and quality of the eggs that are left. So where do they even start with all that? Well, a lot of the time, the first and biggest clue comes straight from you. It's your menstrual history. I mean, look at this quote. If a woman has a regular, predictable cycle, say every 25 to 35 days, that is a really strong sign that she's probably ovulating consistently. But, they don't just go by her history. They have some pretty simple tools to confirm it. You've probably seen those ovulation predictor kits in the pharmacy, right? Well, they work by spotting a spike in a hormone called LH, and that's the hormone that basically gives the green light for an egg to be released. Another way is a super simple blood test to check your progesterone level. That hormone goes up after you ovulate, so it's a great way to confirm it happened. All right, next up is what I like to call the plumbing check. Seriously, that's the best way to think about it. The whole goal is just to make sure the pipes, so to speak, the fallopian tubes in the uterus, are open and clear, with no blockages in the way for the egg and sperm. So how do they check the plumbing? Usually with one of two tests, an HSG or an SIS. They sound complicated, but the difference is pretty simple. The HSG uses an X-ray and some dye, and it's fantastic for seeing if the fallopian tubes are open. And here's a cool little tidbit. Some studies suggest it can have a tiny therapeutic effect, maybe by flushing things out. Then there's the SIS, which uses ultrasound and saline. It's better for getting a really good look inside the uterus itself. And the big pluses? It's usually less painful and there's no radiation involved. Okay, so when you start talking about ovarian reserve and egg quality, you just can't avoid the elephant in the room, and that is the single biggest factor in female fertility: age. It's the question everyone has, right? How much does it really matter? And the data is crystal clear on this. Look, it's a gradual thing, but there are definitely key turning points. Around age 32, the ability to conceive starts to decrease significantly. After 37, that decline gets even steeper, even more rapid.
I mean, they've done studies on populations who don't use any birth control, and the average age of their last pregnancy is around 40. That's a pretty telling statistic. And this is exactly why the advice changes for women over 35. Doctors recommend getting an evaluation after just 6 months of trying, not a full year.
Okay, let's switch gears and talk about the male partner. Now, the evaluation here is usually a lot more straightforward than the female workup. It really all boils down to one simple, non-invasive, but totally crucial test. And that cornerstone test? It's the semen analysis. It's a really simple lab test where they look at a sample to get a baseline on everything: sperm production, their health, how they function. You get so much information from just that one little sample. So, what are they actually looking for? Well, they're checking a few key things against the World Health Organization's standards. First up is concentration, which is just the sperm count. You want to see over 15 million per milliliter. Then there's motility, basically how well can they swim. More than 40% should be moving. And finally, morphology. That's their shape. The benchmark is that at least 4% should have a normal shape. Now, if the results aren't in the normal range, you might hear some of these pretty technical sounding words. And yeah, they can sound a little scary, but they're just very specific descriptions. Oligospermia, that's just a fancy word for low sperm count. Acinospermia, that means they're not swimming so well. And teratospermia, that just means there's an issue with their shape. Simple as that.
Okay, so once you've done the ovulation checks, the anatomy checks, and the semen analysis, for some couples, there's one more piece to the puzzle, and that involves taking a look at the genetics.
Now, genetic testing isn't for everybody. It's definitely not a first step. But it's absolutely critical in some cases, like for men who have a really low sperm count or even no sperm at all. Testing can uncover genetic conditions like Klinefelter syndrome, where there's an extra X chromosome, or something called Y chromosome microdeletions. And for women, it might be recommended if they're dealing with something called primary ovarian insufficiency, or if they've had recurrent miscarriages. And really, that brings us to the whole point of this entire evaluation. All of these different tests, the history, the blood work, the imaging, the analysis, they're all just pieces of a big puzzle. And the goal is to put every single one of those pieces together to build one clear, complete picture. Because that is what lets you and your doctor sit down, have a really informed conversation, and figure out the absolute best, most personalized plan for you. When you boil it all down, this whole evaluation is really about one thing: turning the unknown into the known, right? It's a process that takes all that uncertainty and replaces it with actual information, which gives you the power to make the best decisions for building your family. And it kind of leaves us with a big question for the future, doesn't it? As science gets better and better at understanding the thousands of genes involved in all this, you have to wonder, will genetic testing one day flip from being the last step of the journey to becoming the very first?